I'd begin this with the 8 procedural steps. We'd check her chart, get all the equipment that I need, wash my hands, get my gloves on. I would go to the patient's room, make sure it's the correct patient with 2 identifiers, her birthday and her name. I'd also would scan her when she had it. I would shut the curtain for privacy. I would tell the patient what we will be doing, along with an abdominal assessment. Introduce myself too, of course. And so we're going to do with orientation by 4. First question is, what would you do in a fire?
Leave.
Who's the President of the United States?
Joe Biden.
Repeat after me. All dogs go to heaven.
All dogs go to heaven.
Okay. What time of day is it?
Afternoon.
Okay, patient is orientation by 4. Now I'm going to check patient's pupil, her eyes. Okay, look at me. All right, pupils are dilating normal. She's got red reflux. All right. How many fingers I have holding up?
3.
Okay. All right. Parallel is intact. Okay, I'm going to go on and check patient's nose. Nose is symmetric and aligned. Looking into nose. Mucous membrane is pink and moist. There's no lesions. No edema. All right, thank you. I'm going to move on to doing lungs. Well, I'm going to check heart first. Checking the heart. Sounds okay. And S2 is aortic. Moving on to pulmonary. Moving down to the Erb's point, which is both these are S2 and S2, and this is S1 and S2. Moving on down to the tricuspid, which is S1, and over to the mitral, which is also S1. Heart sounds good. All right, going to listen for percussion. I'm sorry. Here we go. Listening for lung sounds. Oscillating. Okay, and she would be breathing, so every time I moved it. All right, it's clear. There's resonance. Okay, I'm gonna have the patient stand up, and I'm gonna do it onto the back side too. Okay, I'm going to palpate. Tactile fermentus is final. Let's see, almost. I'm going to ask oscillate too. Tactile fermentus is bilateral. All right, repeat after me. You're showing my fingers. 99, okay?
99, 99, 99, 99, 99.
Okay. All right, patient. Or have the patient breathe in deeply and breathe out. Okay, breathe out. All right, there's no crackling. Patient sounds clear. Medium sound. Okay. All right, now I'm going to have the patient. Okay, you're going to have a seat, and we're going to do abdominal assessment. All right, I'm going to have the patient lay down, and I'm going to have her bend her knees so that she's comfortable, and also I'll give her a blanket if she needs it too. Okay. All right. I'm going to start with doing an inspection of her stomach, of her abdominal. There are no masses. There are no scars, no lesions, no stria. Okay, and then from there we're going to auscultate. We're not going to palpate first because we don't want to cause any extra bowel movements. Starting in the right lower column, moving up to the right upper quadrant, left quadrant, upper quadrant, and moving on down to the left lower quadrant. And bowel sounds is normal between 10 and 30 in a minute. If it was hypo, it would be less than 10, and if it was hyper, it would be more than 30. And now I'm going to palpate. All right, and starting in the right lower quadrant again, and we do not want to feel any muscles, muscles. All right, starting down again in the right lower quadrant, which would be the cecum and the appendix, moving up to the right upper quadrant, which is the gallbladder and the liver, moving up to the left, moving over to the left upper quadrant, which is the stomach and the spleen, and then moving down to the left, palpating to the left lower quadrant, which is the colon and sigmoid colon and colon and the descending colon. Okay, all right. Now that we've checked all of that and the sounds of her everything, there's no filled organs or solid. So, anyways, all right. And from their assessment, we're going to move on to skin. Well, yeah, skin. Starting with her arms. She is warm to the touch. She's not cool. Her perspiration is not excessive. There's no perspiration. Her Tugor baseline goes back to 2. And also down would be on her foot too. There's no edema. Her heels, no edema on her heels. No lesions or cuts or sores. There's no edema on her hands. Checking her pulse. Her brachial pulse would be here. Her radial pulse is here. And so the pulse you would check for 30 seconds. It's never 30 seconds, but at the same time, I would be looking for her respiratory. That would also be for 30 seconds. If it was abnormal, I would do it for 1 minute. Okay? And we need to check for musculoskeleton. Also, capillary refill is 2. Okay? All right. Do musculoskeleton. We can do it sitting down. All right, put your arms out. All right, sorry, I'm gonna do this again. Okay, just repeat after me. It's abduct. Abduct just means we pull your arms up. So, abduct. You're gonna stand up. You can stand up. Okay, abduct and circumduct. Okay. All right, abduct. Pull it down. Okay, and do same with your leg. And you abduct your arms again. All right, push down. And we do this bilaterally. Good. All right, push up. Good. Hold against. Okay. We do the same for your leg. You can abduct your arms. All right. We're just going to do one arm or leg. Right arm, leg, abduct. Okay. Circumduct. Abduct. Okay. All right. Abduct your leg. Push down. Pull down. Okay. Push up. All right. Good. All right. That was skeletal muscular. Her joints are aligned. There's no crackling. She can move smooth movement. All right. You can go ahead and have a seat. At this time, the assessment would be over. I would put the patient, put the bed back to its normal position. Ask the patient if she needs anything else. Give the patient the bed, monitor, and from there, I would tell the patient I'll be back in a certain amount of time, so 30 minutes. Make sure the patient's comfortable. I would collect all my PPE, throw any PPE away, wash my equipment, wash my hands, and then I would document everything that happened in the assessment and whatever the patient, her comments and stuff.